So as soon as we know he's not responsive, we're getting him out. Right.
So we have some junk cars that are simulating patients who'd be in car accidents. So what we're doing is we are extracting the patient from the car. Since they're simulating a car injury, we expecting to have some sort of spinal injury. And today they'll practice rapid extrications and putting people in the KED and pulling them out. And normally we'll have extra time, so we'll practice pulling them off the hood of the car or all sorts of strange positions, because real life is not as neat and simple as a classroom.
We've been going from easy to very stable patients that they have a lot of time to work on, and we've progressively changing those patients to become more and more unstable or requiring them to work with less people in more difficult situations.
So right now they're pulling the patient out. He was in a seated position, so they're rotating them. They've put the backboard underneath the patient so that they can fully immobilize him, and now they're going to slide him out of the car. One person's going to maintain holding the head so the spine stays straight. But once they're out of the car, we actually have to attach them to the backboard. So once they're lowered down, we apply a strap across the chest, one across the pelvis, and then one across the legs. And then we will put them on a stretcher. They would obviously put them in the ambulance and transport them to the hospital. So a lot of times when you come to a car accident, there'll be patients wandering around who are not necessarily in the car, but they might have a spinal injury. So you're going to want to put them on a backboard. So the safest way to get them onto a backboard is actually to have them stop and stand, and then you come up behind them with a backboard, and then you'll have one person put on a collar, and someone will hold C-spine, so hold their neck so that their head doesn't move around. And then 2 or 3 people will insert the board behind them, and then they will slowly lower them to the ground so that you can keep the spine immobilized.
Let's see a full multitasking assessment. Somebody could take C-spine, somebody could be preparing the board, somebody could doing a quick blood sweep. So let's try to move this.
It's definitely about teamwork, a lot of communication, which is something we're trying to get them to work on today.
I actually really enjoy this program a lot because it's not just sitting in a classroom just giving lectures. It's very hands-on, and they always are very serious about giving us lots of practice.
When I first started taking the class, I was like, I don't know if I'll be able to do this. But as I've been taking the class, I sort of feel, I have the steps. I know if I see someone passed out, like what the first steps that I should do, so I feel less anxious about how I would react in the field.
We start out the day as the leaders, so we're the ones directing students of who should be doing what and what's missing. By the end of the day, we have students in charge. It's great as an instructor because today I get to see the effect of what we've done all semester, and we're turning people into EMTs.